Welcome to the Workology podcast, where we discuss the science and art of the workplace, gain powerful insights, resources, and perspectives on the industries of human resources and recruiting. Join your host, Jessica Miller-Merrill, chief blogger of bloggingforjobs.com, for an in-depth and no-holds-barred look into the future of our most powerful business asset, the employee. And now, welcome your host, Jessica, with this podcast episode of Workology.
Welcome to the Workology podcast, and thank you for making us part of your week. Today's topic is office ergonomics. It's something that is close to my heart, or maybe I should say my neck and my back these days. And we're talking with Dr. Scott Schuck of Schuck Chiropractic in Oklahoma City, where I'm based out of. In the spirit of disclosure, he's my personal contractor, but I think he's awesome and a good guy that I've known for many years. And he's helped me a lot in the past few months deal with some back problems. And I have a lot of confidence in the information he's going to share with us today. So who doesn't want to have a pain-free back or neck or all of the above? And that really starts with maybe where you're spending the most of your time, which aside from sleeping in your bed is probably in work at the workplace. So first, let me just welcome Scott to the podcast. How are you, Scott?
Doing great. Thank you for having me.
Tell us a little bit about you, maybe more information, fill in the gaps in my intro.
Well, as you said, I'm a chiropractor in Oklahoma City. My practice is a family-based practice. We see everyone from children, newborns, all the way up to the elderly, and just there to try to help people and educate people on having a healthier lifestyle.
Which I think a lot of, and who doesn't want to have a healthier lifestyle and feel better? So let's talk a little bit maybe about what ergonomics is. Can you kind of break it down for us?
Well, real simply put, ergonomics is just studying how people's efficiency in the workplace. And many people think of that in lifting, keeping your back proper, lifting with your legs, all that kind of stuff. But they really don't think about how it relates to them in today's society, sitting at desks and sitting at computers, and how the way they're sitting and the way they're spending their time, as you said, is affecting not only how they feel, but their overall health.
I think about, before I go to bed every night, I'm sitting in my bed with my phone in my hand and my neck pressed down. And when you go around out in public, maybe at a restaurant or different places, that's what everybody's doing. They're standing, maybe their posture's not that great, but they've got their phone in their hand and their body is contorted in these strange ways.
Exactly. And either that or they're not even using their hand. They don't have a hands-free set, so they've got that phone on their shoulder and their shoulder cranked up to their ear trying to hold the phone like that while they're doing other things with their hands.
I actually saw a guy this week who was on his phone while he was pulling golf clubs, and I think he was going to attempt to try to golf with his phone on his hand or into his ear, which I thought that is bizarre, but I guess multitasking these days.
That's what it's all about these days.
So tell us a little bit more about your practice and maybe some of the kinds of work-related injuries that you're seeing on a regular basis there.
The most common thing that we're starting to see nowadays is a lot of that upper back and neck pain, headaches, numbness, and tingling in the arms that is really accountable back to people's posture, sitting at the computers. They spend so much time sitting at computers, and most of the time we're slumped over them. We're slumped over our desk. You're looking down at a monitor and putting a lot of stress on the neck and shoulders. And so we're seeing a lot more people coming in that are having that upper back, neck pain, headaches, which then leads to numbness and tingling and many other things going on.
I feel like you're diagnosing me right now. Like I'm raising my hand, me. But it's a real thing. So let's talk about how we got here, and maybe some mistakes that we are continuing to make, and maybe how we can approach our lives or our workspaces differently and improve.
Much of what people need to really look at is just when they go to sit down at their desk, are they sitting up straight? When they look at their computer monitor, is their computer monitor at a level where they don't have to look down at it or look up at it? Do they have to look from side to side? or is it right in front of them? Are they able to sit with their hands at a keyboard where their shoulders are rested and just down, relaxed in a relaxed position, and their hands just fall naturally on the keys? Um, how are they sitting with their legs? Are their feet dangling? If it's a shorter person, are they dangling off the chair? If it's a taller person, are they sitting with their legs crossed under the chair? Or are they sitting on their feet? How many times do you walk into an office anymore and you see people at the reception area that are actually sitting on their legs and that kind of thing while they're sitting at their desk?
And so those sort of things are things that you suggest that we avoid doing?
Yeah, definitely. Yeah. Well, you want to avoid sitting on your feet. You want to sit in a relaxed position. Try to make everything while you're sitting there. You're going to be under enough stress because you're at work most of the time and different things like that. So if we take some of those physical stresses off our bodies, then you'll be able to make it through the day and have more of a chance of not having these recurrent problems and not having these problems come up that so many people are having now.
So one of the things, I guess, about me and I think maybe most people who are experiencing maybe some back pain or neck pain or some ergonomic issues or just posture issues is we kind of avoid it. I know that I have until that moment where it is too much to bear or it gets so bad that we need to go in and see you. What do you suggest that, what kind of approach do you think people should take over time? I mean, obviously best case is not, or worst case is going in to see you when it's so very bad, but what are some things maybe they can do at home or at the workplace to help make better choices for better posture and ergonomics?
The main thing is really being more proactive about everything. So many times in our lives today, we are waiting until it hurts so bad we can't stand it anymore, or waiting until it's hurting so bad that our hands are going to sleep, we can't hold our coffee cup, whatever it might be. But the real thing that if we look at and start being more proactive and setting up those workstations so that they are taking stress off your spine and taking stress off your upper back and everything while you're sitting there. Taking time to get up and walk around a little bit while you're at the workplace. So instead of being at your desk for 8 hours straight, get up every hour or so, just walk around, get just a little bit of movement other than just sitting there. While you're at home, if we're eating right, getting some exercise, that's going to help avoid a lot of these issues also, because the sedentary lifestyle that people are starting to lead is what's leading into so many of their back problems and their health problems and so many of those things like that, because they're just not taking time for themselves and taking time for their health.
Well, I've heard that sitting is the new smoking, and it's kind of the workplace crisis or part of the workplace crisis that maybe employers are now facing. Are there just is injuries from just too much sitting?
Oh, there certainly can be, and people don't think about it. Like I say, they think about ergonomics as being lifting heavy things properly with their legs and not using their back. But the body is made to be able to adapt to certain stresses. But if after a certain amount of time you continue to stress your body in ways that it's not meant to be stressed in, such as sitting slumped or slouched at a desk for many hours, many days a week, for years on end, your body loses its ability to adapt to those stresses. And as it loses the ability to adapt to those stresses, that's when we start seeing some of these things come up that are truly a type of injury, but it's just occurred over a long amount of time, and it's not a lifting type injury. It's just a more of a stress injury from long periods of time where your body just finally can't adapt. It's the straw that broke the camel's back, so to speak. You can handle so much until just all of a sudden that adaptability is just stressed to the max and your body can't handle it anymore.
Well, let's take a little bit of a reset. This is Jessica Miller Merrill, and you're listening to the Workology podcast powered by Blogging for Jobs. Today's topic is office ergonomics, and I have Dr. Scott Schuck here. His website is www.schuck, chiropractic.com. And he is my chiropractor and friend in Oklahoma City. Very qualified, lots of good information he's sharing all around ergonomics and how we can kind of make some small changes to avoid maybe visiting his office as frequently as I have been lately. Can you tell us maybe one piece of sage advice for employers? What maybe policy change or something they could do to make it safer in the workplace?
I think that goes back to also just being more proactive with things. They're looking to try to save money and to really watch what they're spending when they're looking at their employees and that kind of thing. But when you look at, 50% of Americans end up having back pain at some point in their life. Back pain is one of the most common reasons for missed work. So if they would actually just take some time to look at how they have their people spending their time, whether they're spending it with less stress on their spines and less stress on their backs and less stress overall, in the long run, they're going to end up saving money because they won't have that missed time from work. They won't have those people that they're just not as productive because they're sitting at their desk, they're hurting, they've got, whether it's back pain, whether it's headaches, they're just uncomfortable. They're not a very productive employee. And so by taking those little steps of just making their workstations more ergonomic with the proper height on the monitors, with headphones so that they can talk on the phone and still type without having to do that whole holding the phone with your shoulder. Good chairs where they can sit up straight and have some back support. If they need it, something to support their feet so that their legs are at a good angle and not stressing their lower back. Even down to just the little deals that go into your wrist while they're typing. So it helps support your wrists a little bit. It takes a lot of pressure because, carpal tunnel is one of the biggest things we're starting to see, along with the upper back and neck pain from spending so many hours on a computer day in and day out.
I have thought a lot about carpal tunnel, and particularly I think we'll see more of what I call Twitter finger. And it's that texting kind of thumb thing that you're doing with your mobile device.
Yes. Yeah, that's been a big thing with kids, and we're starting to see it in children now. They spend so much time. You watch them walk down the halls at school, and they're got that phone out. They're texting, they're typing, and they're hunched over and slumped over, and that just carries right over into our adult years as we're spending more time on technology and spending more time not only in the workplace but on our home at home and on vacation and everything else. We spend so much time on that social media, we spend so much time on our phones that you're getting a lot of that thumb pain and wrist pain. Used to be only in video games. Now you've got adults coming in that they've got thumb and wrist pain, and they just spend so much time on their phones that they're just overusing those joints and overusing those muscles.
So taking a break from your phone, or maybe downloading a voice dictation app or something like that to give those thumbs and fingers maybe a little bit of rest sounds like a good idea.
Most definitely. It would definitely help a lot, take a little bit of stress. Any little thing you can do like that just changes how you're doing things. So you're being more proactive, as I've said, of just keeping yourself from getting into a position where you are hurting so bad that you can't go to work. You're hurting so bad that you're not being as good a parent, as good a spouse, and just enjoying life the way you should.
I feel like the Workology podcast supports good ergonomics because we are not asking you to read on a screen or a phone. We're taking advantage of your headphones and the power of voice to promote, hopefully, good behavior, relax a little bit, enjoy as we fill your brain with some useful knowledge here.
That's definitely great. That's why I was sitting here at the house trying to figure out where I was going to do this at, and it makes it so much easier when I can just sit on the couch, just relax. I've got my notes and got the computer just sitting here beside me, and don't have to worry about how I look or where I'm looking or anything like that. So it's great.
If all of life could be that easy, I think.
Yes, definitely.
So we have a little bit of time left, and I wondered if you could maybe share some examples, if you have, of maybe a company or somebody who has a really good track record for improving office ergonomics. I mean, what comes to mind that we can learn from, or from a company that's done something interesting on this front?
There's a lot of different companies out there that are trying to do some different things, and to actually name just one of them makes it very difficult. But I think if you look at so many of the places that are going to standing workstations, because they found that that is part of what can be difficult also, is finding that good chair. But when the person is standing up and working standing up, they're getting a little bit of exercise while they're working. They're putting less stress on their spine actually by standing rather than sitting. So there's a lot of different things like that going on in a lot of these bigger businesses that are being more proactive and looking at what they can do to have their employees be more productive in the workplace and then enjoy life more as they get out.
I have an interesting link that I'll include in the resources section here on the transcript of the podcast. If you just go to bloggingforjobs.com and in the right-hand search bar section, put in office ergonomics, I have some nice resources for you. One statistic that I just wanted to point out, 1/2 of all working Americans admit to having back pain symptoms each year. And 31 million Americans experience lower back pain at any given time. Lastly, Americans spend at least 50 billion, that's 50 with a B, billion, each year on back pain, and that's just for the more easily identified costs. So certainly making some small changes in your workplace is going to not necessarily, or not only just help your spending for maybe healthcare costs, it'll maybe significantly lower those, but it's going to make for happy, healthy employees that are coming to work and are doing their best every day, which is really what we want.
Yes, and the one thing that getting off, it's hard for me to talk about just the pain side of it and everything else, but if the employer really starts looking at how the nervous system functions and the many other things that they might have employees missing work for that are maybe even stemming from those pinched nerves in the back because of the way the nervous system controls everything else in the body, I think they'd be really surprised at how much money they would save in missed days at work and how much more productive the people would be when they were there if they really looked to making these changes. And even, if they looked at having somebody like myself come in and just do some health talks and do some talks about some good basic ergonomics, and maybe even have some programs where they were covering chiropractic for their employees, because they are going to see a health savings in the long run based on less missed days of work for the back pain and all those issues, but just in the increased productivity because of how the people are working, how their bodies are functioning.
And it's sneaky things like you wouldn't think about. And you've talked about this before, like even the spine and this overall posture and health with chiropractic, it impacts things that you wouldn't think about, like maybe indigestion or allergies. You've opened up my eyes to a whole other world when you talk about those areas.
Exactly. And, that's why, people look at the back pain and everything like that and that side of it, especially in business. But what they don't realize is that some of the back pain is causing other things, like you say, as heartburn, acid reflux. Maybe it's causing where your body's immune system just isn't functioning right. And so you spend more time having issues with the common cold, or you're more likely to get some of these flus and viruses that are going around and miss work because of that. So by taking care of your spine and taking care of your nervous system, it's not only going to help how you feel, it's going to help how your body is actually working and how your body functions, so you'll be healthier overall.
Well, thank you, Scott, for taking the time to talk to us about office ergonomics and how good posture and good spine health can help improve the workplace and productivity in ways that most of us probably didn't even imagine. Is there a place that people can go to connect with you if they want you to come and speak at their workplace, or maybe continue the conversation after they hear this podcast?
Oh, most definitely. My email address is Dr. Schuck, DrSchuck, at schuckchiropractic.com. And they can feel free to call my office and leave a message there, and I'll get back to them as soon as I can. And that's 405-602-8925. And I would love to help anybody out there, whether it's coming in and personally helping them or finding somebody that might be in their area or close to their area that can come in and do the same thing that I would do.
Well, thank you so much, Scott. I appreciate you spending your time with us. This has been Jessica Miller Merrill, and this is the Workology podcast, where we discuss the art and science of the workplace, HR, and recruitment. Until next time, you can visit Blogging for Jobs to listen to all our past episodes of the Workology podcast. Thanks, and we'll talk to you soon.
Production services for the Workology podcast with Jessica Miller Merrill provided by Total Picture Media.